CSC Practice Test 2026 NEW Cardiac Surgery Certification Exam 30 Questions Answers. Question 1. How should you identify a resident? Ask their roommate. Check their room number. Check their ID band. Call them by name. ID band is the standard identifier. Question 2. When a resident is on NTO status, they can have water only, ice chips only, nothing by mouth, clear liquids. NPO means nothing by mouth. Question 3. What is a living will? A bank account, legal document about end-of-life care, a birth certificate, a list of belongings. Advance directive for medical wishes. Question 4. When feeding a resident, you should rush them, offer small bites and wait, use a straw for everything, talk to other staff. Prevents choking and promotes dignity. Question 5. Which of these is subjective data? Blood pressure, weight, resident's report of pain, pulse. Subjective is what the resident says. Question 6. When dressing a resident with weakness on one side, dress weak side first, dress strong side first, dress both at once. It doesn't matter. Dress weak TVW, undress strong. Question 7. What is the first step when discovering a fire? Rescue residents, activate alarm, contain fire, extinguish. Race protocol starts with rescue. Question 8. What is the best way to prevent the spread of infection? Wearing gloves, wearing a mask, hand washing, using antibiotics. Hand washing is the #1 way to prevent infection spread. Question 9. What is the golden rule of charting? Only chart at the end of shift. If it wasn't charted, it wasn't done. Use pencil. Include your opinions. Legal documentation standard. Question 10. A resident falls. What is your first action? Help them up. Call for a nurse. Move them to bed. Give them water. The nurse must assess for injury before moving the resident. Question 11. Which of these is a sign of skin breakdown? Redness that doesn't go away, tanned skin, dry skin, freckles. Non-blanchable erythema is a stage 1 pressure injury sign. Question 12. Standard precautions should be used for only HIV patients, all patients, only MRSA patients, patients with coughs. Standard precautions apply to all patients regardless of diagnosis. Question 13. A resident wants to complain about care. You should tell them to be quiet, inform the nurse or ombudsman, ignore them, tell them they are wrong. Residents have a right to voice grievances. Question 14. A Foley catheter bag should be kept on the floor, above the bladder, below the bladder, on the lap. Below the bladder to prevent backflow/infection. Question 15. A resident is choking and cannot speak. What should you do? Wait for help. Perform abdominal thrusts. Offer water. Hit their back. Abdominal thrusts Heimlich for complete obstruction. Question 16. Where is the radial pulse located? Neck, ankle, thumb side of wrist, inner elbow. Radial is at the wrist. Question 17. Which position is best for a resident having trouble breathing? Prone, supine, Fowler's, Sims. Fowler's upright aids lung expansion. Question 18. Abduction means moving toward the midline, moving away from the midline, turning a joint, straightening a limb. Abduction is taking away from midline. Question 19. Postmortem care is for before surgery, after death, after birth, during sleep. Care given to a body after death. Question 20. What is the normal oral temperature? 96.6 F, 98.6 F, 100.2 F, 97.0 F. 98.6 F is average.